Is it visible?
Yes, sir.
Is it?
Sir, if you are ready, we can let the participant in.
Yeah, you can let the participant in. I just need some time, that's all.
Okay, sir.
You do your work. Meanwhile, I have certain work with the PPT what I'm going through. So you do that, no problem.
Okay, sir.
1 minute. Shall I share a video which I wanted to share? Shall I see sharing a video?
Yes, sir.
Is it visible?
Yes, sir. It is visible.
It is moving.
Yes, sir. It
Moving.
is moving.
Okay.
Yes, sir.
Okay. 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 You carry on with your work. I just need some time to just set this PPT.
Okay, sir.
Okay. Okay. Karthik into achu malla ID endu phone la mail achu.
Good evening, everyone. The greatest glory in living lies not in never falling, but in rising every time we fall. With great joy and immense pleasure, I extend my warm welcome to all dignitaries, guests, and delegates present here for the Dr. S. Sudhir Raj N. Memorial Free Webinar Series organized by DIKSHA Academy in association with Ayurveda College, Coimbatore, under the banner of Asadi Ka Amrut Mahotsav. In today's section, we will be discussing about unveiling the importance of nasya in clinical practice by Dr. Prasanth Dharmarajan.
Before starting the session, I would like to go through few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbances-free session. In case of any disruption, please check your internet connection first, and if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any question can be raised, posted in the chat box. Questions raised will be cleared at the end of the session.
Next, I would like to invite Dr. Devi S. Nair, Ma'am, Associate Professor of Roga Nidana, Ayurveda College, Coimbatore, to deliver the welcome address.
Thank you. Good evening, one and all. So, under the banner of Asadi Ka Amrita Mahotsav and Dr. Sudhir Rajan Memorial, we are conducting the free webinar series. So, on behalf of Ayurveda College, Coimbatore and DIKSHA E-Learning platform, I am welcoming Dr. Prasanth Dharmarajan, sir, Assistant Professor, Department of Panchakarma, All India Institute of Ayurveda, Delhi. Sir, it's a very happy moment for me because I got an opportunity to meet him once in All India Institute campus. So it's an unforgettable day where his friendly nature and down-to-earth behavior, also the way he explained from the infrastructure till how to face a interview, how to write article, everything was really informative. So today I know the session will be really informative, and I would also like to tell he is going to explain on the importance of nasya in the clinical practice. So once again, I welcome you, sir, And also I am welcome all the delegates who are waiting here for the session. Thank you.
Thank you, ma'am. It is a great pleasure for me to introduce our guest speaker, Dr. Prasanth Dharmarajan, sir. Dr. Prasanth Dharmarajan, sir, completed his UG at SJM College of Ayurveda, Hassan, Karnataka, and a PG at Alvas Ayurveda Medical College, Mudbidri, Karnataka. Currently, he is working as Assistant Professor, Department of Panchakarma, all in the Institute of Ayurveda, New Delhi. Sir has over many years of experience and has presented many national presentations. We are extremely obliged to have you here, sir. Now, without any further ado, let me hand over the session to Dr. Prasanth Dharmarajan, sir, to enlighten our minds with this knowledge. Over to you, sir.
Thank you. Just give me 2 more minutes. I'm just getting ready. The PowerPoint which I have has some issues, so I'm just setting it out.
Okay, sir.
I'll be ready in 2 minutes.
Okay, sir. Due to some technical issues, the session would commence within 2 minutes. Thank you for your patience.
I'm really sorry that I've kept you waiting.
No problem, sir.
Okay, I think it's set up. All participants. Is my screen visible now?
Yes, sir, it is visible.
Okay.
Okay, sir.
So, very thank you to all of you for inviting me to be a part of this. Am I visible? I think I'm half visible. Namaste to all of you. Very thank you to each and every one of you. It was a very busy day. I was running around. So I'm sorry that I couldn't actually fix up the things the last minute. So thank you for inviting me for this very relevant topic, unveiling the importance of nasya karma in clinical practice. So I just want to start or begin with remembering my gurus. I still and truly feel and believe that I am like this small kid who is next to the ocean, who has been taken by his gurus to see the ocean for the first time. And the ocean is nothing other than Ayurveda, which I am still astounded to watch and see its endless, spread across. So the first feeling that a kid has by seeing an ocean is what is going through my mind when I was actually trying to explore something about Nasya. Thank you for the wonderful introductions that has been given, and I'm really sorry about making you wait for it. So we know about Nasya. We are very confident about Nasya. So I'll just show you a video. I want to start by showing a video. Is this video visible? Is a
Yes,
video?
sir. Yes, sir, it is visible.
Yes, sir.
I think what I need to convey is over now. Right. The entire thing that is to be said about Nasya is over in this short 2-minute video which was shown to you. So I was just showing a video which is one of the most common mode of practicing Nasya. So is that all? That's my question. That's where I want to begin with. If this is what is to be conveyed about Nasya, what is this presentation about? What am I trying to convey to you? Or what should we actually think about practicing nasya? So I want to draw your attention to actually, travel along with me, unlike learning a subject, just trying to think in a different perspective, uh, which, I think is something which all our teachers have, uh, given us. Let's see right from the beginning. To begin with, if we see about the Nasya Karma, we can find that this is basically explained in the second chapter itself, with these various Aushadas being explained in the Apamarga Tanduluya Adhyaya. So when we look into the context of why is it explained there, we can actually infer that maybe because the first chapter ends with the Vamana Virechana Dravyas, explanation of Shodhana Dravyas. Probably the second chapter had the inclusion of all these Dravyas which were really required for Nasya Karma. And then later when we can see all other things being explained in Aragodiya, wherein which is all explaining about the Bahi Parimarjan. So right from the explanation itself, there is a very great flow of Nasya right from beginning. And if you see this chapter also, it has the first time mentioning about the word Panchakarma, Tan Upasthita Doshani, Snehasvega, Upadani. That reference itself is coming from specifically in the second chapter of Charak. So moving forward, right from where it begins, I want to just think about the importance of why Nasya should be so much seriously considered. If you look into the concept of our classics, it's clearly quoted Urdhvamulam Adashakham, and if it is so, Mulam Praharani Tasmat Rogan Shikhataram Jayet. So, like a tree, a human body is like an inverted tree. Urdhvam, Mulam, and Adhar Shakha. And when you actually try to approach through the Urdhvanga, then you can completely control the diseases which is happening around the body. So this is not just a limited approach, it is an approach which is totally throughout the body. So we need to understand that right from the importance of Shira in human body. Shira or Murtha is very important, as you all know, because I had an image of a helmet over here. Remember, when we ride a bike also, we only have a helmet. They don't ask us to completely wear a level 3 jacket and ride a bike. They always tell us to wear a helmet, because Shira is the location where all the Indriyas are conglomerated. All our Indriyas are located in the Shira specifically at one point, and if we don't protect Shira, then we will not be able to protect our eye. So we always limit Nasya as a Urdhva Jatru Vikara Chikitsa, which is not like that. It is very, very elaborate. It is, we know that one of the most commonly practiced conditions, commonly practiced therapies, but it is useful in various conditions, which are not just restricted to Shira, which is not just restricted to Urdhva Jatru. So it is something which we can explore on the go. So as it's quoted, it's like the sun and the rays coming out. The Shira and the Indriya, the connectivity between the Shira and Indriya is like the sun rays. So if you block the sun rays at any point, the light won't come. The sense organs will be always in some kind of masking. So how beautiful explanation is that? That the contact point between the rays or the senses and sun is the Shira. So we have to ultimately protect the Shira, and Shira has this wonderful approach called Nasya, as we all know it. And I'm sure that every one of you who are listening to this presentation is very well aware about the anatomical structures. Like birds, we have sinuses in the entire skull. which is just to reduce the weight of the skull bone and to hold on this 1.2 kilogram brain which is there inside. And you have this nose, which is seen as two nostrils from outside, but you can see the turbinates, the sinuses, the various associated structures which are coming right from adenoid, which is developing into another part when growth takes place right from young age. So it's a very complicated structure, but it's a very good opening, not just an opening to the shira, but an opening to the Urdu Jatru itself, because right from all the diseases and all the conditions that is happening, even in throat or imagine cervical spondylosis or kind of degenerative disease being managed by nasya. So the extent or the level of reach of this is something which cannot be explained, like how it is told in Basti. So it is really wonderful to know that. We know that it is one of the generally preferred OPD procedure because it's very easy to adapt, as I have shown you in the video. It has both local and systemic effect, as we all know it. And like Basti, I'm very much comparing it to Basti because I feel it is very, very important and relevant. I myself was studying it when I was just trying to prepare it, and I was like extremely confused because it is like if Ayurveda is ocean, I think this is becoming a Indian Ocean as such. So it can be used all in this preventive, promotive, curative, rehabilitative, all the different modes. And we know that intranasal route is an encouraging path for delivery of drugs to the brain. And there are many theories which states that nasal delivery of drugs can occur through nasoepithelium. We'll talk about that in the mode of action. And it has been useful, found very useful in various disease conditions which are systemic as well as the localized. So I want to begin with the synonyms which we always use as an undergraduate student. We always come across various synonyms like navanam, nastakarmam, shirovirechanam, Shirovireka, Murda Virechana. So these are all synonymously being used, and this describe a particular variety of nasya karma. If you see at Shirovirechana, I've given the reference. So it's Murda Virechana. Basically, Virechana is meaning elimination. And also there is another beautiful reference which is called as Nasta Prachardana. So which denotes that there is a Shodhana Nasya which can be done through this nasal route. And also the word Nasta and Navana are also commonly used, Nasta Karma or Navana Karma, because it is based on the route of administration. And it is not just about the nose alone, it is about the nose and all the surrounding structures across the nose. So basically, it is based on the main function of elimination of the morbid doshas, and it denotes the site of administration and measures which are beneficial to the nose. So if you look at the basic definitions that we always keep on repeating about nasya, nasayam praniyamanam aushadam. So basically, it is all about the route or the pathway which is explained as the definition of nasya. When you go into a detailed part later on, it is even explained like Tailadibihi, Aushadam va siddham dravyam. When it is being given, Nasikayam, then it becomes Nasya. So the explanation of Nasya itself is like step 1, step 2, step 3. You are being more and more elaborated about the definition or understanding about Nasya itself as we move forward. And when we look into one of the aspects, it's told that this is only indicated for Dhira. So Nasya karma is not a karma which can be very easily practiced in any kind of Dhiru. I still remember one of my experiences. I had an opportunity to show different Panchakarma videos to various nationalities once, and when I was showing to certain non-Indian people, they were okay with Jaloka, they were okay with Prachana, but they were absolutely not ready to look into nasya karma, because they were so absurd about the way how things are being instilled into nasal pathway, especially oil and liquid things which we used to in nasya karma. So it is not very common, like what we think, that it is a very simple and it's a very uh, light procedure. So as we all know, I don't have to repeat these things. We know that every part of a what do you call vanaspati or dravya can be used right from fruit, leaf, fruit, and each part specifically as a dravya is very elaborate. Each part can be specifically used in various kind of nasya karma, and it has been explained in detail. So this is something which we always write for our exams. Whenever we get a paper, we like to get back into the flow chart and the algorithms that we write uh, on the classification of nasya. I think barely a university will skip this question on classification of nasya karma according to various acharyas and its practical utility. So I'm sure that every one of you will be very, very aware about this navana, vapitana, mapana, dupma, and pratimarshana. Say we have our own codes of NADDP or whatever it may be, and then we have the types. Based on each acharya, this is Charaka's classification. We have different algorithms or flow chart which we have, which we always by heart and understand to an extent of what are these basically. As we all know, Navana is like oil or liquid which is being used. Avapita is nishpidate, that means a kalka is used, and mapana is about a powder. Pratimarsha is again oil, and it's a specific dose which is mentioned. And Dhumana, we know that it's a smoke which is used by burning drugs. So when it comes to Sushruta, we have a separate explanation. Again, Shiro Virechana and Snehana, which again has Shiro Virechana, Vapida, Pratmana. Then we have Snehana Nasya and Pratimasha Nasya as two division of Snehana Nasya itself. So everywhere we have classifications, and we always quote it beautifully as an abstract in all the examinations and all the papers that we got till date. So I think that's the way how we are trained to learn, and we are supposed to learn until when we are learning in undergraduation. So if I was to tell again the same thing and then present a presentation, I don't think that there is no any point in explaining something. So we know that there is Matra Veda, Marsha and Pratimarsha. We know that in Karma Veda also you have these things. But if we seriously try to analyze this and try to classify it, actually we can classify Nasya into various components based on its Matra, based on its Karma, based on the Dravya which is used, and based on even the yantra which we use, or the apparatus which we use to do the nasya karma. So based on matra, we know that each kind of nasya has been specified with a kind of matra or a dosage. So that differentiates the nasya. Then you have karma. As we know, there is brahmana, shamana, shiro virechana, like simple shodhana, shamana, and brahmana. Instead of shiro virechana, I'll quote it as shodhana itself. So Shodhana Nasya, as we all can understand, can be used in conditions or situations where Shodhana is required. Your intention is Shodhana of Urdhva Jatru or Shodhana in that condition. And Shamana, specifically, if you see Stambhana, etc., the classification of that, wherein it is specifically meant for Paitika and the kind of Vikaras which are Rakta Pradoshaja. Then you have Brahmana, where it is mainly meant for Vataja or Kevala Vataja, Dhatukshayaja, Brahmana kind of disorders where the Brahmana is recorded. Shiro Virechana or other kind of Shodhana Nasya, specifically we can see in like conditions like Visha, etc., where Sanya Prabodhaka, etc., wherein we need a Shodhana to actually revive things. When you look into the Dravya, we have Pradmana, Avapida, Snehana, and Dhuma. Look, around 4 different varieties of materials are used: powder, liquid, oil, smoke. Then the name changes or the kind of nasya changes. And if you look into the yantra or the kind of apparatus used also, you have pranadi, you have kalka, you have pichu. If you go into the variety, when you go into the detail, you'll see that you have various kinds of things which is being told for and instilling nasya into the nasal pathway. I think one of the things which is missed here is kala also. Even kala is one thing which can be considered, because pratimarsha has a different kala than what it is in different. When it's marsha and pratimarsha, there is a matra difference and also a kala difference. Again, we can classify this. If you actually broadly try to classify Shiro Virechana and the Nasya Karma, we can, one is on a side of Brahmana, and one is on a side of or Brahmana or Snehana, or a kind of positivity, and one is on the kind of, Langana, wherein things are being tried to be removed from the body. So we can invariably classify into various modes. But these are my suggestions, the way how to understand it. That's what I feel when I try to analyze. This is how I could. Otherwise, we will always go with Navana and the classifications which are mentioned by Acharyas, and it will remain there. I want it to be practically adapted. And if we need to do that, we can go one by one. What exactly this means. So it's a Navana Nasya, to begin with, the most commonly synonymously used thing. It's a Nasya which is instilled by use of oil or grita, and oil is considered to be sreshta when it comes to nasya. Charaka has described pranadi, a pipette or a dropper kind of thing for it to be administered. Navana is generally the sneha nasya, is known as nasya in general, and it can be mainly classified into snehana and shodhana. So Navana name comes from basically using oil or grita, but again it can be classified on base of its karma, one as snehana or the brahmana kind of thing, and the shodhana or the eliminating kind of thing. So what is snehana nasya? If you look into these three kind of differences, like based on its matra, based on its benefits, and based on its indication, basically snehana nasya is indicated in hina matra as 8 drops, matima matra as 16 drops. It's not drops, it's bindu. 8 bindu. You can see I'm turning around. I've kept my students here. They have to listen. They are the ones who prepared. So it's 16 bindu and it's 32 bindu. So it's not drops, it's bindu. And benefits of sneha nasya, as we all know, is basically it gives strength to neck, shoulder, and chest, and increases eyesight. So to be very true, I went through online resources to check on what are the available resources on nasya. And somewhere I came across a wonderful presentation by Prakash Manglasheri sir. And after seeing the presentation, I felt that around 80% of the presentation I cannot even be able to interpret what it is, because it's such a beautiful presentation and it's so elaborate, and it's even there in that Ayurveda network by BHU. So it has all details about nasya, and it was one of the another factor which made me myself miss sir again, because if he was around, I would have called him and asked him, sir, these are the doubts which I have, how should I clear it? So having a good guru is very, very blessed feeling. So in this line which I'm quoting, it gives strength to neck, shoulder, and chest, and increase eyesight. He has put a picture of Arnold Schwarzenegger into the slide, which I still remember as the benefits of Nasya Karma. So someone who practices regularly the Nasya Karma can have these benefits. And if you look at the indication, as it's a Sneha Nasya, it's basically indicated in Vata Rogas like Vatika Shirashula, Kesha Patna, Danta Patna, like various kinds of hair fall, Timira, Nasa Roga, Shosha, Apabahuka. So it's like, once in your mind, get into that point. Among Navana, the Snehana Nasya, which is told, is meant for actually, opposite to Vata Vikaras, which is really beneficial. When it comes to Navana, you again have Snehana Nasya with this, here it is corrected as Bindu. Various Samyak, Ati Yoga, and Ayoga Lakshanas are also told. And even drugs are also specifically told for this, which are all Brahmana in nature. Okay, so it is something about the Snehana Nasya. When you look into Shodhana Nasya, as we all know, Shodhana is all about removing things from the body. So Shuddha Shiro Virechana is the type included in Shodhana type of Navana Nasya. It eliminates the vitiated dosha. So basically in Shodhana Nasya, oil or Vrita which is prepared from Shiro Virechana Dravya like Pipli, Shigru, Ushna Virya Sadhita Dravyas are used for Shiro Virechana kind of Shodhana Nasya. Here also the Matra is different. There it was different. Here it is totally different. 8, 16 and 32 Bindu was there, whereas here it is 8, 6 and 4. It's like half. So when it comes to Shodhana, they require Tikshna Dravya with less kind of dosage. So when it comes to Avapidanasya, the second Navana Avapidana, I'm going with the same old pattern, but again it has what you call kind of divisions which are based on Stambhana. We have which are specifically told like drugs in wet form like Patra, Kanda, Kashaya, other dravyas which are taken in Kalva Yantra and triturated well, and they're prepared into Kalka. So it's a Nishpidana karma which is done. So Kalka, Avapidate iti. So you have Shiro Virechana Dravya, like various kinds of dravya which will help in Shodhana also. Or at the same time, you can use it as a Stambhana Dravya when there is Urdhogata Rakta Pitta. Very commonly we use this Durva Swarasa, Durva Ghrita if not available. Sharkara and Ikshurasa are also like Shita Virya, Stambhana Dravya, Rakta Stambhana specifically. Other kind of Stambhana Dravyas can also be used. So it is kind of such dravyas which differentiate this Avapita Nasya into various categories. So I'm sure that you are clear about Navana Nasya and Avapita Nasya. So now coming to the detail of it, as you know that Chakrapani clearly tells it's based on the Kalka, and it is again divided into Shodhana and Stambhana Nasya. Sushruta only recommends about Shiro Virechana Nasya in that, and already this I have told. Kalka of Tikshna Dravya like Saindava, Pippali, etc. are being used for this Nasya. For Stambhana purpose, we can use drugs which have Stambhana properties. And Videha on the commentary on Sushruta has also quoted on dull by dull and about Videha's opinion that there is also Sanya Prabodhana and Stambhana kind of Shodhana. Coming to the third variety, which is Mapana. As we all know that Pradhvana, Mapana or Mana, as these are like kind of synonymous words which are used. Churnasya Atmapanam Tadvi Deha Sroto Vishodhana. So I think it is a nano expulsion of particles which are quoted here. So it's a Virechana Churna which can be used, Churnasya Mukhena Natya, Pradmanam. So there are wonderful description. I cannot explain it to you with the kind of happiness which I'm getting when actually I'm reading this, because kind of imagine 5,000 years back our sages have explained it so beautifully, because even now the scientific world is in the research of finding out the reach of nanoparticles. Like, there are a lot of papers which you get about pollution and the particulate matter. Even the mask which we were wearing, the N95, what was that meant for? It is all based on the particulate matter which can be inhaled into the nasal pathway, which can cause the infection. So they had such wonderful thoughts of how a drug can be administered through the nose in various forms, like right from liquid, lipid, powder. So it's really wonderful. 3 Muchuti or 1 Shukti Pramana is being mentioned. And we know that what is Muchuti Pramana, Tarjani, Angushta, Agramala. It's like a pinch, a single pinch, like 3 Muchuti is being told. And basically, this is a kind of Vairechnik or Tikshna Nasya, because it's all the powders which are used. Even a non-Tikshna drug is used as a powder, we will be really irritated and having a few sneezes, right? So it's basically indicated in Cheto Vikara, Krimi, Visha, wherein things has to be expelled from body. So that will be really helpful, it seems. So that's how it has been told, and you have explanation about how to give, etc. So I have just tried to correlate how it has been explained. In Pradmana Nasya, Churna is administered through the nasal passage with the help of Nadi Yandra. Shad Angula Nadi, both side open-ended, I have seen people using straws to do this, or else a simple nadi which is kept from one end and blown. But I think it should have two ends in one part, wherein it goes to the nostril and it goes equally into both the nostril. The chuna is kept at one end and the air is blown from the other end, so that the medicine may enter into the nostrils simultaneously. And Vidya has commented another method of pradmana in which fine powder of drug is kept in a potli made by a thin cloth, and it is used to inhale so that the smallest particles of the medicine enter the nostrils. Can you tell me an example of this which we all have used in our lifetime? It is this Vicks inhaler. I always find a Vicks inhaler very similar to this thing, even though it might not be a powder, it might be the nanoparticles of that component, volatile component, which is there inside, like a sketch pen. They have a spongy material inside which they keep this volatile oil and other material which are required to be absorbed by when inhaled, and that is being used. Remember, so there are a lot of avenues which we have not even thought about. How many studies have occurred in Mapana Nasya? How many research work have been carried out? So there are a lot of areas which we need to explore, and I think that it's a drop of water from the ocean which we have taken and tried to explore. We have Dhumanasya. We know that Dhumanasya is also very unpopular in comparison with Navana or Avapida. We have the types of them also, like Prayogika, Snahika, Vairechnika. And in Dhumanasya again, we know that it is, don't confuse it with Dhumapana. Dhumanasya is basically indicated in Sleshma kind of vikara, where Ruksha, Ushna things, like after Vamana, etc., what we use the Dhumapana, it is different. This is Dhumanasya itself, wherein drugs which are burned in the form of smoke is inhaled through the nose and exhaled through the mouth. So, when you look into the age limit of this, it should be given below 18. Should not be given below 18. So it is contraindicated. So it is not the smoking below 18 to be taken. Don't confuse it. It is even told that even what is being inhaled through the nose is not Dhumapana, not Dhumanasya, it's Dhumapana. There is reference which is there. So it is specifically indicated after Snana, Bhojana, vomiting, sneezing. We have always read these things. So basically it is divided into Prayogika, Snehika and Vairechnika. The drugs which is used to differentiate it into Snahika, Prayogika or Vairechnika, along with the length of the apparatus which is used, that is the length of the netra which is used for the Dhuma, like the Pranadi, 36 angula, 32 angula, 24 angula. And also they have mentioned about the times of inhalation, how much times you have to do that when there is a condition where it is indicated. So it has not been explained by Sushruta as a type of nasya separately, but as I mentioned, smoking through the nose is not indicated as such. So the procedure is like one is made to sit comfortably, and you are made to inhale the kind of Dhumapana with the kind of Pranadi and the Matra once or twice through one nostril. 3 times you are made to inhaling through one nostril, and then you have to expel it through the mouth. Now you will be very familiar about this position, this kind of procedure after your Vamana karma, when you do a Dhumapana. But how does it differentiate Dhumanasya? One, based on the drug which is used. 2, based on the pranadi which is told, based on the length of that. So it totally differentiates it. And the kind of diseases which are indicated are like right from Karnasrava. When there is middle ear infections, then the powder or the liquid which can reach, the smoke can reach and clear out any kind of middle ear infections. Karna, Akshi, Asya, Srava. When there is too much of kapha utkleshana, you are doing something with Ruksha, Shushka Dravya to actually. Puti Ganda Kandu. When if you remember, Vrina Dupana is also told. So when there is krimi, when there is kind of infections, our acharyas always thought about kind of smokes. Smoking can be very useful. Then penis, all these things. I've mentioned the contraindication. Look at this: Rakta Pitta, Virikta, Udara, Meha, Timira. So all these conditions with the Tikshna, Ushna, wherein there will be sudden increase of things is being contraindicated when Dhomanasya is being explained. Coming to the most commonly used nasya, which is Pratimarsha nasya. We know that it's like your Yapana Basti or Matra Basti. Sarvakalam Deya. Every time you can use it, no problem, anytime. We ask everyone to take 2 drops every morning, evening, whatever, as Pratimarsha nasya. But again, Pratimarsha nasya has Shodhana and Snehana kind of thing. Dvi Bindu is what we always tell everyone, that Bindu is translated as drop, which is not. Indications, if we look into the indication, it is indicated as specifically in Shatakshama, Bala, Vriddha, etc. And it can be self-instilled, unlike an Asya Karma. And it is in very less dose in comparison to other kind of thing. And Ajanma Maranat, you can actually use it. And you don't have any kind of specific requirement which is needed for the procedure, and it's of long-term utility and less complications. So there is a lot of Pratimarsha Kala which we see, and these two things, if there are undergraduate students, I want you to take this photograph of the slide. I will share the slide, but why I am telling is there will not be a university which will not ask these two questions. Again, one is the difference between Raksha and Pratimarsha Nasya, and second one is the Pratimarsha Kala. So these are very common questions what is being used. So don't just learn it as a answerable thing, but understand it. So based on the time of administration for this Pratimarsha Nasya, they have told that these are the times which you can actually administer. It's not that all these times you should administer, but these are the times which you can administer. Options, guideline. If your intention is Srotasam Shuddhi, then these are the time which you need to administer it. If your intention is Klamanasha, then you should administer in these situations. If you want Drigbala, then you should use it in these conditions. And if you want Dantadardya, in these conditions, and all specificities have been carried out here. When you look into the difference, specific Kala, here there is no specific Kala. There are Kala which is actually like inclusive of all the Kalas. The action is fast. Here it is long term, and the dosage is larger when it is in Mashanasya. Again, here it's mentioned drops. It's Bindu. Here Bindu. I'm correcting it. In one way, this mistakes are really good, because we have a discussion about drops and Bindu coming. As when we discuss about Nasya, that is one of the most important thing which we should be thinking about. And here it is not indicated in Bala and Vriddha. Here it is specifically can be given everywhere, and it is more in quantity. This is very less quantity, and there is complication chances, and there is no complication chances. So now coming to the point of Bindu, we talked about 8, 16, 32 Bindu. Then we talked about 8, 4 and 2 Bindus. So these are the various kinds of Bindus which are explained. And if you understand, as we all know, that Pradeshini Anguli Parvadvaya, like dipping the index finger, the first two parts, the amount of oil which drops is what Bindu is considered as. Then comes the question whether it is physician's finger or whether it is patient's finger. Then everybody tells it's patient's finger. But now we cannot make the patient dip into the Gudanagara or the Thaila which is kept in front of you, and then put the drops accordingly as per that. So as per present scenario, there was a lot of studies, lot of works among Panchakarma and Shalakya specialists across the country to find out what is the quantity of a bindu, and they could find out that it is approximately 0.5 ml. But there is a missing here. The missing part is, as per Ayurveda Pharmacopoeia, Formulary of India, 1 drop is 0.05 ml. 1 drop is 0.05 ml. That means 1 bindu is 10 times more than the 1 drop. That means 1 bindu is approximately 8 to 10 drops. So one is this 0.5 ml, what I'm quoting as approximately 0.5 ml is the outcome of various researches. Various researches where Pradeshini was dipped could find out that 0.45 ml or 0.5 ml, Kottakkal, Jamnagar, various standard institutes like Bangalore, many places conducted this research to find out that it is approximately ranging from 0.4 to 0.5 ml. But as per Ayurveda Formulary of India, it clearly quotes, it's there in the presentation of Prakash Dar also, it's very clearly mentioned there. So 1 bindu comes to 10 drops. That means, can you please calculate Marsha, Nasya, Avara Matra, Madhyama Matra and Paravara Matra? 6 bindu is 60 drops. Madhyama Matra is 80 drops. And Pravara Matra is 100 drops. So I'm sure that you will all be very skeptical about it. Even if you go to the Avapida Nasya, which is mentioning the lowest dose along with the Shodhana Nasya, even there you have 40, 60 or 80 drops. So even 2 drops that we give for Pratimarsha Nasya will account to about 20 drops. So this is a very confusing part when it comes to the Matra. When you translate it with the research part, it will become 100, 80, 32. Now comes the question of practicability. So I have made my students make a calculation which they did on base of the dose and the kind of adapting that we can do. Because when it is in Nasya, we have different kalas which are told. So we can also give Nasya in same day on a divided dose. There is mentioning about Sayam and Prata. So when you look into these bindu, we can actually convert into drop, and when it becomes ml, you can actually divide it into the divided dose of the milliliter. If you divide those dose into each time, then as it is told that morning and evening, if you give it in 2 divided dose, the kind of drop that we have to drop, I think this will be shocking again, should be 1 nostril should be given so much of bindu. It is not about 2 nostrils. So considering 2 nostrils, it will be 2 times a day. That means each nostril 15 drop into 4 times. That means 15 drop in 1 nostril, 15 drop in second nostril, then in the evening again 15 drop in 1 nostril, 15 drop in again the second nostril. Same way 10 into 10, like, you know. So this is what classically, if you even consider the Avara Matra, this is the Avara Matra which is considered. So I think to be in a mediocre, this is what I am suggesting. To practically really adopt a Marsha Nasya or a Shodhana Nasya, let us at least adopt half of the dose which is being told when it is being calculated practically. So now you can understand how less are we practicing Nasya or Nasya Karma. So if you look into this 15 drops, and morning you can adopt 15 drops 2 times, in evening you can adopt 15 drops in 2 nostril, each nostril. Same way, when it comes to Shodhana Nasya also, you have this 10 drops, Snehana Nasya also this. So what will be the practical dose of your Pratimarsha Nasya then? At least 5 drops each nostril. Remember, all other taila that we are using most commonly are avartita taila. And Avartita Taila is packed in 10 ml. With this calculation, even you can imagine the quantity of number of bottles that we need. And one Avartita Taila costs around 200-250 rupees. So I'm not telling just Avartita Taila, all Tailas can be used, but there is a lot of practical thing which should be thought about. So at least this is the dose which we should follow. To tell about the doses, I have colleagues and friends who follow even doses up to ranging from 18 to 32 drops in single nostril. I follow a different pattern, which is again very wrong. That's the reason why I took this topic to learn it more. I try to adopt it in an Arohana mantra. And the reason why I think that is because Sneha or Snehapana also, when we are adopting it in an Arohana mantra, it is really beneficial. So now after this presentation and the discussions, what I feel is even what I practically have gone to a maximum extent would be around 18 drops to 20 drops. I myself have also not gone beyond that. But in reality, you should go. This is what is the outcome. At least on a Avara mantra, if you are trying to conduct any kind of Mashanasya or Shodhana Nasya, this is the minimum level of drops and the Aushadhi which you should think about and use. So that's about the Bindu and drop. I hope I'm clear about that part. So it's well tolerated, convenient, and it's the same principle. The main differences between the drops. So again, drops is written, it's Bindu. So once again, Bindu converted into drops will come around 5 drops. So whenever you advise a Pratimarsha Nasya, my sincere request for you is to at least suggest 5 drops in each nostril as a Pratimarsha Nasya. So coming to the indications, these are the most common indications that is being told. But if you look into the presentation that was done by Prakash, there is indication based on localized indication, systemic indication, indications on cosmetic purposes. It's a very wonderful presentation. So I'm still holding his hand and seeing the ocean. I don't know anything about it, but you can actually differentiate it in such a beautiful way. It is very, very elaborate and very, very whole systemic. Like, remember the thing that we told about Urdhva Moolam, Atha Shaka. This is a kind of differentiation I could get from a presentation wherein somebody has differentiated it based on different kinds of nasya where it can be indicated. But this might not be true at all the times. This is a generalized kind of principle, but there can be a Shodhana nasya even indicated in a different situation based on the avastha. When you come to the kind of basic different prakar of nasya, what I was telling, basically it is meant for these 3 intentions. One is Brahmana, one is Shodhana, and one is Shamana. If you look into that also, these Shamana nasya can be probably indicated in these kind of vikaras, which are Shudra Rogas or like a small kind of disease. When it comes to Brahmana, mainly Vata vikara, wherein opposite quality is required. Sneha is required, Snigdhata is needed, Shitata is needed. So Vata Shula, Suryavarta, all these things requires Brahmana kind of nasya. Whereas Vairechnika nasya or Shodhana nasya is required in kind of Kafaja Shira Shula, not Vataja Shira Shula. Kind of Kapha related Avishanta, Gala Amaya, so all kind of Pitta and Kapha related Utklishta Avastha you can think about. Vairechnika or Shiro Virechana nasyas. So once again, I have just tried to concise it based on the old differentiation, which is very familiar for everyone. Avana, Avapira, Mapana, Dhumana, everything. So this is again a part which you have a lot of scope to think about and explore about, because even 1/10 of these are not explored. We highly concentrate with Urdhva Jatru and just remain there. So we have the question, we thought about matra, we thought about types. Now we need to think, when should we administer this? So according to Vagbata, there is your wonderful description when. According to Sharangadra, there is a description when, and everybody has different opinions about administration as course. Right from, you can administer on alternate day, you can administer on a gap of 2 days, you can administer on up to 7 days, or you can administer at a gap of 21 days also, as per Sushruta. So like Snehana and all other contexts, we have various opinions. When Boja tells after 9 days it becomes Satmya, Vagbata also has this various opinions. So basically, how will we understand this, when to administer? Wrong slide came in between. So there was a slide about Kala. It is not here. I think it is missing. There was a slide of Kala which was prepared. Is this one? Yeah, I think when we cover about the nasya karma, we will be talking in detail about it. Just to look at the contraindications, we have contraindications which is mentioned in various conditions and the reason why it is being told. Like for example, if you do a nasya in ajirna or kind of bhukta bhakta, what happens? So these are not any space science, these are very simple, direct principles. So anybody should not need to by heart these things. You can actually understand these things, that in such conditions or in such situations, you should not do it. So there is a detailed explanation and kind of, things what we learn as indication, contraindication is not just a theoretical aspect. It's a very practical thing, which is a guideline. It doesn't mean that all these conditions we cannot do. We can do when the proper avastha comes also, like how it is mentioned for Basti in Prameya. So let us look about nasya karma than what we discussed already, as what is being told in classics. So we know that we always describe these things in all these three divisions: Purva, Pradhana, and Paschat karma. And Purva karma includes Sambhara, Sangraha, and what is the term which is used for examination of patient? Rogi pariksha, Atura pariksha, and preparation of patient Atura siddhartha. So I think one of the acharyas later part, when translations were made, all the previous students of Ayurveda tried learning in this format, which was easier, so that nothing is missed. And these coin terms became a part of our Bible, and it's really good that we still use it. And it is very systemic and classified so that it can move forward. When these three are being actually gone one by one, let's see how it is. So when you look into Purva Karma, we should actually think about Arha and Arha, which we already discussed, indication, contraindication. And then you have this Rogi Pariksha, as we all know, Dushyam Desham Balam Kalam. We always quote about this, but we rarely do this in our clinical practice, which should be very well done. Because if we don't look into these variables of a person, Ayurveda ceases to be what Ayurveda is when it comes to clinical practice. So you need to look into the Dushya, Desha, Bala, Kala, Prakriti. For example, the matra that we will be planning for a person from Kerala or Tamil Nadu will not be the matra which you can think about when you actually think about someone from Punjab. So the Bala or the Desha, it will totally differentiate the kind or quantity. It is common for all the Panchakarma things. Sambhara Sangra, all the requirements or prerequisites which are detailed in this next part of the flowchart, Nasya medication which you have chosen as, whether it is Navana, Avapidna, Mapana, Dupana, or the kind of Nasya which you are going to do, either it is written Abhanga, Abhyanga, Taila. Gokarna, how did Gokarna come? Gokarna is not mentioned anywhere. There is a translation of Shuktika, as what Anand sir has told, when Nasya is explained in Sushruta. Ashtang Sangra Shuktika is coming, wherein Shuktika or conch is being translated for shell is being translated for Gokarna for easy adoption of this procedure. But as such, Pichu, dropper, direct from this, everything can be used. So let us not go behind that part. But it is also one of the easy adaptable things. So don't wait for Nasya Karma to be done until you procure a Gokarna. Sometimes in government hospital it too happens. So Nadi Svedana Yantra, not necessarily Nadi Sveda, you can even have a face steamer which you get for 150 rupees, because any kind of tapa Sveda is only required. Cotton pad, lotus petal. I'm mentioning who wrote it. It is written by Dr. Ashwati, who is my PhD scholar here. So the intention of lotus petal, cotton pad, everything is to just reduce the kind of ushnata which will be caused during Svedana, to keep the Urdhvanga cool. And the hypothalamo axis wherein the temperature difference will influence, and warm water for Kavala, Saindava Yukta Jala for Kavala. Dhumavarti kept ready for Dhumapana after the Nasya. Whether it is Dhumapana or Dhumanasi. Dhumapana. So now coming to the Rogi Pariksha, Deshadi factors, as I told, Sambara Sangra, preparation of patient, position of patient, very, very important. What is the position which is being told? What is the position? Kinchit Unnada Padasya. So it is not to lie down with the pillow below the neck and tilt your head so that you will be looking like a tilted, snake. Rather, it is very simple Shavasana, wherein you just need to relax yourself and place yourself so that you are very slightly relaxed. Because first it is told for Dhira, second it is told this position is very important, because if you are afraid or scared or uncomfortable, the entire Nasya Karma will be in trouble and you will be having a lot of complications. So if you look at that, you need to be very clear about the position. Nasya table 7 by 4 feet not required. You can even have it in a normal bed also. A normal wooden bed can have a Nasya Karma easily done if it is having a good positioning for the person who is actually instilling it. Gokarna not necessary, you can do with anything. 2 attendants not at all necessary, 1 is more than enough. And anyone back at home can also do that. Medications as your doctor prescribe, stove, glass, steamer, everything. I mean, these are things which are mentioned. You know it. I'm not going to repeat it. So, Snigdha Svinna Uttamanga, installation of medicine. Then Snigdha Svinna Uttamanga, we saw the live video how it is being done. Now, my question is only one thing: whether this Snigdha Svinnata is to be done only in the neck and face. Urdhva Jatru is only required. That's your yukti, depending on the condition. If you are actually trying to do it on a swasa, tamaka, or any kind of condition where you are looking into the specific, for example, imagine you are doing a Brahmana Nasya in a Dhatukshaya Janya, Amsa Shosha. If you don't do a Sneha Sveda in Amsa, then what is the point of that Nasya being given? So it is based on the condition. So these are all guidelines. So let us not fix onto these. Let us be very open about how to understand these guidelines and adopt it according to our own yukti. Vairechanika Dhumapana to expel out the remaining kapha, because ultimately when you do that from the Urdhva Shira, the kapha will be expelled out, or the doshas along with the kapha will be expelled out. Gandusha, like Vamana, we are doing it after. So you have checklist to be used before Vamana Karma. Imagine when we even go to a bathroom in a mall or an airport or a railway station, you have a checklist for a cleaning staff who cleans the toilet. Why can't we have checklist for Panchakarma procedures that we do, which are the most important therapies that we conduct among Ayurveda physicians? So it is very necessary, and I'm really happy and once again privileged that my sir, Prasanth sir, and team has also developed various fitness forms, checklists, and in All India Institute of Ayurveda, we have assessment and checklist for procedures, and workshop for standardizing this will be conducted very soon. And after that, since 7 years we are adopting it here, so it will be standardized and validated, and it will be published so that everyone across the country can use that without mistake and adopt it, so that we becomes really, you will be very aware, even if a pilot goes into the flight for the 250th time, only the pilot walks around the airport like a king. But when he enters next to the airplane, he has to go through the checklist with each and everything. And imagine an Ayurveda person becomes a pilot. Will he be doing the checklist again? So we should. This is a very important part of it. So we need to check Purva Karma, and as we know the course, we were discussing about the duration previously, and then we left it. We had opinions about various duration. This is the missing slide from there and here. So when you look into the duration, we have also discussed Purva Pradhana and Paschat Karma. We can continuously give for 7 days. In conditions like Vata dosha in Shira, Hikka, Manya, Stamba, Swarabheda, etc., it may be done twice in a day. So the use of nasya on 3rd, 5th, and 7th and 8th day, or till patient shows the symptoms of samyak nasya as stated in Ashtanga Sangraha. You have samyak karma lakshanas. You can do that. Bhoja says that if nasya is given continuously beyond 9 days, I told it. Sushruta nasya may be given repeatedly at an interval of 1, 2, 7, and 21. Charaka has not mentioned specific duration, but he has only mentioned that until the severity of the disease. So I feel it is once again like the basti. Even though you have yoga, kala, karma, bastis, there is yugma, ayugma, basti explanation. Nobody has told you that you should only do it till then. You should only do it like this. You can only do it like this way. Even you have chatur padrika basti, even you have a basti indication wherein you can give sneha basti continuously, nirva basti continuously. So it is all based on the kind of avastha or indication. So here what I suggest for all students as of now to understand, let us fix it like this way. As a suggestion I'm telling, you can adopt it practically for continuous 7 days in situations which are required. And when situations are not very favorable, you can actually do it on alternate days or on a specific gap of 2 days. So as told previously, morning and evening, you have the reference to give this nasya. What is this 579? The number of days which is mentioned previously is again repeated here, or until samyak lakshana. I go with samyak lakshana than 5-7. Like for example, snehapana. When you talk about snehapana, you always talk about snehapana 5 days, 7 days, 9 days, mrudu koshta, madhyama koshta, krura koshta. But it's not like that. It is until the samyak. You should find or be focused on the kind of goal that you need to reach. That is samyak lakshana. So I think in here also you will be. Have you mentioned the samyak lakshana? So the schedule of vikaras, which can be specifically seen that when it comes to various vikara, there are also differentiation of timing. So morning or evening based on various vikaras. So if you look at this also again based on ritu. So ultimately, what I understand from all these different kind of explanation is that it should not be too hot. It should not be too cold. You can adopt nasya when you are in a normal sadharana dina. For example, as of now, it is heavily raining in southern part of India right now. So it is not indicated right now to undergo a nasya karma as per the classical principle. But on an exceptional condition, wherein a patient is admitted inside a hospital, wherein the effect of this rain is not being obtained by the patient directly as much as he would be living outside on an IPT basis, undergoing a nasya karma would not be an issue. But these are all guidelines that we should understand, and these are all guidelines which we should understand and interpret on base of our yukti to follow practically. So there are multiple opinions, but we should fix on the kind of intention at which, like it is like the kind of things which are told in our what do you call Aiti Himalaya, etc., wherein they tell don't cut your nails on the night, booth will come. The same way, there is some kind of reason why it is told. We should understand the reason behind it. And so there are various references on timing, time schedule on different ritu based on the temperature or the kind of variation that happens on that ritus. Daily in morning and evening in Vataja, Shiro Roga, Hikka, Patanaga, as mentioned previously, can be given in night, suffering from Lala Sava. Why? Because again, based on the dosha, you can see that. Same schedule for different seasons as Shruta has mentioned. So there are multiple opinions as all of them are different. So it is there. So Pradhana Karma we have already seen. This is a repetition again. So we have this SOP, again repetition. We have previously told us what is the SOP. No, different smart arts tried on for the same thing. Nasya Vidhi is 3 times repeated again. So, considering it is a presentation of Nasya, they wanted to be very focused. So, once again and again, it was, as always, it was mentioned, the Samyak, Ayoga, and Atiyoga Lakshana, like all other karma, is also mentioned here. All acharyas have similar opinions. There is no much difference on all the 3 lakshanas. If you look into it, it will be always about the Shiro Lakhavata, Sroto Vishuddhi, Sukha Swapna. So you can imagine what will happen when such a Samyak Yoga will happen. When it comes about Ayoga, you can imagine that the Ayoga means the complete intention of a Nasya Karma is not followed. That, like what I was telling, when you are giving a very fancy position to him, probably it will go somewhere else than what it is being thought about. So Galopaleba, Shiroso Gurutvam, Nishtivanam Cha. So it will be like Indriya Vaigunya, like there will be complete blockage, like how you have a cold. That is what you should understand when there is Ayoga, and when there is Ati Yoga, like you should understand there will be Ati Srava or Kapha Prasega, Gurta Indriya. So these are things which you should not by heart, you should understand based on understanding the procedure. And I request all the Ayurveda enthusiasts to undergo the karma now based on this revised suggested dosages, which are truly high than what we were practicing till date. So if you look at once again Samyak, Ati Yoga and Ayoga, this is the most simplified format of it. So when we share the slides, you can actually look into it and keep it as a learning resource for always looking into the references and the conditions at which you can use it. Coming to Paschat Karma. So when it comes to Basti, there is a lot of controversy. What are the Paschat Karma? So there is Anusuga, Mardana, Vama, Dakshina, Parshva, Nishtivana, Sweda. I think this is even more simplified. Previously itself, we have already told, only thing is we differentiated it from the Pradhana Karma. So simply after the entire procedure, so how will the procedure be like? After adapting the Purva Karma, you are instilling the dosage as per the matra into each nostril, bindus into each nostril, pratyeka, and then waiting for a certain time until it is reaching the throat. Then doing a Nishtivana on Vama or Parsha. Usually what people do is they get up from the table, which on a practical sense is not advised. As when you get up, again things go down. Let it be there. So if they can actually from the lying down position itself go to Vama and Dakshina, then it would be much better. Again, Svedana is given as the Ashtanga Sangra procedure goes, which is very, very good because it will again help in the reach of the entire Nasya Dravya throughout the entire Urdu Jatru. And then Dvitiya Matra of the Nasya is given. Again, we told that it should be given in divided doses. So first imagine what is the largest quantity that you have discussed according to Matra. 30 bindu, which 32 bindu, which is how many drops? 320 drops. Now, among the Avara Matra, what we suggested, what is the highest? I think I remember it as 15 drops for one time in one nostril. Then 15 drops for the next nostril. So this second 15 drops, after dropping it to one nose, you can ask the patient to lie down, go to that side and do the Nishtivana, then do the Svedana, again give this into the next dose. Or else you can do half of that dose into both nostrils once, and then ask the patient to do Nishtivana on any side, whichever is feasible, and then repeat the dose. So this would be the practically possible suggested procedure, which will be really beneficial. We will revise our procedures here on all these spaces, and Ushnodaka Gandusha, and that too after the Vairechanika Dhumapana. Usually we always use with Haridradi Dhumavarti, which is very commonly used. But actually, you can have various kinds of Dhuma, like, based on the kind of nasya which is adopted, even you can actually customize the Dhumapana also for that. Because any kind of Dhuma will kind of do the outcome that it has to do with the kapha pralepana, what is going to happen. So you can even customize that. That's what I feel. Ushnodaka Gandusha. Then Snehapan mein, whatever is being told, same achara vidhi should be followed here. So I think this simplifies the Paschat Karma into a systematic way. And Pradhana Karma, as mentioned previously, we have discussed. Purva Karma also we have discussed in elaborate. So what is the title of this? It's not visible. Complications. Yes. So it basically happens if the medicine is not administered in proper dose, matra, kala, then it's his position and proper karma, or else if done in any kind of ayoga or atiyoga, any kind of ayogi or ayoga avastha. Then now coming, basically it is divided into two, kshayaja and doshokleshaja complications. Usually people think that there are no complications for nasya karma, but there is clear-cut reference which tells about it. So there will be irritations, relapse after 2-3 days when the mucosa comes adjusted, frequent, hot. What is relapse after 2-3 days? Relapse of the irritation. No, the nasya dravya, which is administered on a complication, can repeatedly come out, even after a gap of days also. So it will be either on a kshayaja or an utkleshaja avastha. When it's in an utkleshaja avastha, it can repeatedly come out. There can be burning sensation, repeated sneezing, pratishaya. These are very common things which we can understand. Heaviness of head, like the way how I have told for Atiyoga. So it will be Murcha Ayoga and Atiyoga again are the various other kind of this which is being told. This is the kind of assessment chart we use here. We will be standardizing and publishing it in a public domain. So once again, it is repeated about the bindu and the dosage forms which are being told by various acharyas. Ayurveda Formulary of India mention it as 0.05. 1 drop. Remember, 1 drop is 0.05. By all the studies, 1 bindu is 0.5 ml. Various journals have published articles. We have even taken screenshots. Couldn't be attached. So 0.45 to 0.55 is the dosage form as 1 bindu. So if it is 0.5, then it is 10 times. So 0.05 ml becomes 5 ml when it is 10 drops. So that's the calculation we have done, and that's how we try to simplify the dosage. Now coming to the most important part, everybody was waiting for, what is the kind of yogas which can be used in various kind of nasya dravya, like in conditions. Vatika Shirachula, Brahmana is the kind of line which we look into. Varunadi Kshiragrata, Varunadi Grata, very useful for nasya karma. Even Varunadi Taila is also used and beneficial. Ksheerabala, I think it is the most misused nasya dravya among all our Ayurveda practitioners as a Brahmana dravya. Very commonly, easily, Tanvantaram and Ksheerabala is very commonly and easily available. Mahamasha Taila. Vatika Shirashula, again, you can think about Bala Hatadi Nasya. Then you can think about all other kind of Brahmana Taila or Grata, which are Vatahara in nature. Now, when it comes to Pittaja Shirashula, Stanya is being mentioned, Durva Swarasa is being mentioned, Sharkara, Shira, Ikshu. So these are things which will be helpful in Pitta. And when it comes to Kafaja Shirashula, Apamarga, Drona Pushpi, Gudanadara, I have myself undertaken Gudanadara, not for Shirashula. My teacher had given me back, I still fondly remember, in sinus blockage and sinusitis, which was happened because I have a deviated nasal septum. So always I used to get sinusitis in cold places. So my teacher first made me undergo a Shodhana. That is a big question. As of what I have been taught, all my teachers have taught me that as a part of Purva Karma of Nasya Karma, every person should undergo either a Vamana or Virechana as per the Prakriti and the Roga Avastha or the condition which is there, because then the effect of Nasya Karma will be double. For example, if it is a Shodhana Nasya, probably you can directly go for a Nasya Karma. But if it is a Brahmana Nasya, a previous Shodhana will enhance the quality of the Brahmana, which will be post the Shodhana. So, Kushta, Vyanga, you know the kind of things which can be adopted. These are based on the references and practical experiences, what is being used where. So, as these slides will be shared with you, I don't think that I should explain these things. So, these are very commonly used and found things. So coming to conditions like diabetic retinopathy, we have found good results in not only diabetic retinopathy, optic neuritis, in conditions of retinal hemorrhage. When I heard the condition, I was shocked whether retina will have a hemorrhage. Retina has blood supply to it. Well, it's a non-vascular organ. How will it have hemorrhage? But retina is held on by a small vascular tissue which supplies blood to it. So retinal hemorrhages, etc. We had wonderful results post Shodhana with which Krita did we use there? Jivantyadi, I guess. Jivantyadi. So there are different kinds of medicines which we tried, which was Madhyashtyadi Taila, which were Shita Virya again, which was very specifically Pitta Hara Chakshushya. So there are very good results in that. It is not that claim that it is going to change everything, but on the assessments which were done by our Shalakya department on various instruments, fundoscopy, etc., it was really different. Pakshagata also, I hope that everybody of you have listened to Ravi Shankar Parvaje sir. If not, you should call sir and invite him, and please make him listen to your lecture too, because he has wonderful presentation on stroke, and he has managed more than 2,000 patients of acute stroke conditions also. So it is an experience which will be very, very worthwhile learning. And we also have a lot of cases coming. So we usually go with the avastha. When we want to do a brahmana, we go to that level and do select such kind of dravyas. When we want to do a kind of shodhana, we will do. But initially, when pakshagata come based on the avastha, we approach, and there is very wonderful good results. Acute cases come within 2 days, 3 days. There are chronic cases which comes within months together, and there are also late cases which comes. All have multiple pathologies. Some of them will be a CVA based on hemorrhagic pathology, or some of them will be infarct. But ultimately, the presentation is what we look upon to, and the kind of lakshana which will lead into the treatment principle is thought about and managed, and very well. We even have patients coming down from Bangalore. The last patient discharge was from Bangalore. So it is a very good condition where this can be thought about. These are also certain other conditions. So to mention something more, I feel like some certain rare conditions which we could find very good results where trigeminal neuralgia. I think for the practitioners who are there around, they will be very familiar. We could find very good result with kind of Brahmana nasyas which we have invariably used right from Shirabala. We could get wonderful results based on the person medicines were decided based on the avastha. Brahmana, basically the principle used. Cervical dystonia. Cervical dystonia is a condition wherein you have focal dystonia which will advance into that. So use of Maharaja Prasarani Taila as nasya is very beneficial, along with Shashtikashali, etc., which are being done externally. So you have invariable opportunities and invariable options to select, like Basti in Nasya also, the kind of dravya and the kind of medicines to be adapted. So even people have studied about the use of Panchavidha, Kashaya Kalpana and Nasya. And you also have a concept called Nasa Pana, where Nasya itself is given in a very large amount, which is coined by Chakradatta. It's a modified procedure like Jalaneti. It's it has been advocated as a dosage of dravya for Nasapana should be similar to the Kashaya, that is around 1 pala. So 48 ml, approximately 40 ml. So you can imagine in the number of drops how much it would be drugs used. Contraindications of Nasapana, like Nasya, curative aspects. So it's not much different. It's almost similar itself, but the dosage pattern is a bit different, and the kind of there are a lot of claims like which Chinnadara, etc. So what is required in Nasya? Both will work in it, because ultimately it's not about how it is going there. The point is about whether it is reaching there or not. So the medicine and the effect will be based on the entire procedure which is being done right from the Purva Karma. So here again, some more references about the Nasa Pana by Chakradatta, Baladikwata, Dashamuladikwata, Mash Baladikwata, Jalapana. So mainly all these liquids are being considered here, Kwata based. So you can go through these references from Chakradatta for details. So even there are papers which you will get based on the SOPs which were formed for Nasapana, or concept or mode of action. Prasanth sir has done it. So there are many things that you will get on the details of Nasapana even as publications. So coming to the final part of the presentation, I cannot skip it without even attaching two screenshots of what Prakash sir's presentation was there. We know that already sir in his presentation had its slides directly as such. There has been a lot of studies which was done on nasal applications on luteinizing hormone, ADH, insulin, contraceptive, steroids. So there are a lot of studies which have been done from the modern medicines about the nasal usage, or I think even a complete system exists on the study of this, which completely has explored the delivery through nasal pathway. So when it is compared to the oral pathway, what is the advantage is that oral pathway has an inhibition through the digestive process, but whereas IV, nasal, other things, they don't want these things. So in IV, etc., 100% is being absorbed. That's the reason why they are considered superior. Same way, even nasal passage has a faster delivery to the bloodstream. It is the level of medicine will be higher in the blood levels, and the destruction by digestion is not there, and they don't have to overcome the metabolism to become the active ingredient to be available in the entire system. So it will pass on the metabolism and it will reach the portal circulations. This is what happen when it is through the oral route. Liver enzymes break down, but nasally delivered medications avoid the gut, and the bioavailability, like what I was telling, it is really, really high, 55 to 100%. So it's like 50% above than what it is being through a oral route of administration. So as Ayurveda tells, it is through our Sringataka Marma. It spreads throughout the Murdha, and it reaches at the junction where Netra, Srotra, Kanta, and Shiromukha. What that can be? The junction of Netra, Shrotra, Kanta, and Shiromukha, like New Delhi, all capital of head. It reaches the central point, and from there, the morbid doshas from Urdhva Jutra are completely expelled through the nasal pathway by the spread of the and Charaka and Vagbada mention one specific anatomical structure like a munja and ishika. Munja can be like munja means like it's like small grass. Munja is a variety of a grass, and ishika like painter brush. So these are things which can be correlated to olfactory bulbs and neurons which are adjacent to it, which are joining and taking it up. So if there is some reach of the medicine studied, I think nasya is only one thing which has been a bit explored, wherein we could find that there is bioavailability of this nasya dravya which is being administered in the central circulation which is there. And I'm glad to say that even one of my friend, I had actually a screenshot for that also to be attached, which I couldn't. So one of my friend is even exploring on once again studying a condition of Alzheimer's with from All India Institute for the reach of nasya dravya as so I think Saraswata Grita. The study is now finalized. It is being done with IIT. So it's a preliminary study to see the reach of bioavailability of the pathway of nasya karma. So there are many postulations which are told, like neuronal pathway, diffusion, vascular pathway. But I think the Ayurveda explanation itself clears it all, right from where it reaches and then from how it is spreading throughout and how, what it is doing. So if your mind seriously wants to understand it to modern principles, you can imagine, even you see a nose from outside like this, you have these terminates, you have an entire pathway with all these attachments towards it right from the mucus level. And remember, we are administering lipophilic substances which are very close for the what do you call the nasal epithelium to make it permeable and get it inside. We are doing it in a Sukoshna mode, so it relaxes the area it can do. So these are various vascular diffusion, neuronal pathways are different pathways which are explained as postulated theories for absorption. There are few traces of things also which have got for us as leads to explain that these will reach. And what I need to convey is like we have wonderful clinical results as a practitioner when we practice nasya karma, not just in disorders of Urdhva Jatru, but in systemic kind of disease. If you remember, even in Kushta, there is references in Gada Nigra, which is telling about what is it? Pakshat Vamanam Mase Mase Rechanam, and it ends with Nasya. So you have very systemic administration of nasya karma totally. So these are certain references. Conceptual analysis of nasya karma in Netra Roga. This is a table which is showing Netra Rogas by different acharyas and the kind of best dravyas which are mentioned for it. So this you can refer. Concept of nasya karma and Visha, when you studied Agata, and I'm sure that it is even still practiced in folklore and traditional practices of various parts of the country, because snake is still one of the most common found animal around, and naturally these Visha is still there, and I'm sure that the hospital is not something which is still a reachable institute in India as of now. So I'm sure many folklore healers are doing it across, and even Agata Tantra in Our state also is very famous for Visha Chikitsa. Nasya Karma on Manyastamba, cervical spondylosis, premature hair graying, Khalitya, allergic rhinitis. If I keep on listing it, it will be like I will have to take it till 10 o'clock to list the evidences which are quoted on Nasya Karma. It's like wonderful. Nali Kera Jalanasya and Gogrita Nasya. Sharkara Yukta, Nari Kela Jalanasya and Gogrita Nasya in the management of Ardhava Vedaka. Clinical study on the role of Gunja Taila and Patyadikwata. Patyadikwata, not just as Kwata, Patyadikwata Pan in the management of Ardhava Vedaka. So Ayurveda is very much innovative right now, getting more and more user friendly. Comparative study on Anutaila and Mashaditaila Nasya Ardita. I think there are certain yogas also on the right side which are mentioned, which are very commonly used. Efficacy of Nasya Karma in PCOS, very wonderful study, Shatapushpataila, Anutaila. So I'm sure that in every aspect of every anga of Ayurveda, this is very commonly used. Psychosomatic diseases, Apasmara, Sanjnanasha, Unmada, so Purana Grita, Panchagavya Grita, Kalyanaga Grita, we have very commonly used it, Brahmi Grita. So this gives very wonderful results, specifically in the avastha of the disease where nasya is indicated and the intention of it, whether you are doing it as a shodhana or a brahmana or a shamana. So Ashwagandha Taila Nasya and Anidra Brahmi Taila. So I'm just skipping it. There are a lot of senile dementia to Anidra to pediatric age group. This is a very famous thing which Gopakumar sir was always showing in a video wherein Jimutaka Falanasya was very commonly adopted in Koshta Shaka Shuta Kamala. And I remember the video wherein sir was showing the extraction of Pitta after the administration of Nasya. So it's a Vairejnika Nasya wherein you can even expel out things. Even folklore practitioners do. Effects of medicated enema and nasal drops using Trifluridine in the management of obesity. It's like the usage or utility is like everywhere. So when you come to even the site of Central Council of Research in Ayurveda Sciences also, you get links and details of importance of Nasya, practical approach. So there are a lot of references that we can maintain a healthy life by simply pouring two drops of cow's ghee in every nostril. That's a common thought that everybody has thought about. But when I was just going through, and even Prakash's presentation also had explained it, we are only using very less kind of matra of nasya. If we are just using 2 drops, we should be using more. And there are also a lot of folklore practices which is there in different parts of the country, like using of Jimutaka, using of what are the Drona Pushpiswarasa, then Devadali Nasya, etc. as folklore practices which are very popular in different parts of the country. So we should bring that into the mainstream and utilize it and explore it by doing research. So to conclude, I feel that it is a procedure which is easy to perform as we thought, but we should perform it classically. Hassle-free Panchakarma procedure as we thought, but it has a lot of complication. But it is as a part of Ayurveda Dinacharya being explained. So you should remember about the dosage. It is one of the least expensive karma because there is only a Sthanika Abhyanga and a Nasya Karma. But if you go for Vamana, Virechana, you have 3 days of Sarvanga Abhyanga, Sarvanga Bashvasveta, Sneha Pana. So it is less expensive. But as far as possible, don't conduct it as an OPD procedure. Try to adopt it post Shodhana in a IPD level if you are actually thinking about Shodhana or Brahmana Nasya. But as a Shamana Nasya, you can do that in OPD base. One of the most cost-effective treatment for a wide range of disease. It's multi-dimensional, it's replication. Therapeutic approach can be changed according to Matra Kala. You should observe thoroughly for complications. And it's a double-edged sword. Sometimes direct entry of medications can cause what? Cranial. It's like a bullet to the cranium. As Acharyas have explained the junction, remember that. So it is like as useful as dangerous. But on a dhira, where it is indicated for a, remember the qualities of a Vaidya. You should Never think twice. You can easily do it. Don't be afraid of doing it, but do it classically as explained with the correct way. So to conclude, as it's told Ajanma Marana, when you think about the initial phase of birth, you have Katutaila, Saindava, Grita Yukta Nastya mentioned by Kashyapa. But to sustain the life, you have this Anutaila and Pratimarsha, which we should use to avoid the untimely death. And even if you go to a death, this wonderful slide was made by my student Karthik in the last minute. So it's a very wonderful slide. Sanya Prabodhana, to bring back even from a coma state, we can even use, or a death, you can use nasya. So that's the ajanma marana path of nasya. Like Ayurveda, let it continue. So I cannot conclude my session without acknowledging all my dear students and colleagues like Anantram sir, Arshad, who is here with me, Dr. Latika, Dr. Ashwati is here, Dr. Deen Dayal, Dr. Karthik, Dr. Ramesh, my friend, and special regards to Nisha madam, who is my teacher, who has suggested my name for including in this Diksha, and Dr. Anjima was persistently calling me since a year to be a part of this program. Thank you once again. Remembering once again all my teachers. If there is, I'm sure there are a lot of mistakes. Please forgive me. I'll read, learn back, and get back to you. I'll practice really what is mentioned and then get back to you again. Forgive me. Thank you once again. So thank you from all of us here at All India Institute of Fire. Thank you.
Thank you, sir, for such an amazing and insightful session. So shall we move to the question and answer session, sir?
Yeah, sure.
So we have few questions in the chat box. Shall I read them out, sir?
Yeah, I cannot see the chat box.
So shall I read them out?
Yeah, it is there.
Can Pratimarsha Nasya be used for running nose or sneezing?
No, never it can be used in a running nose or sneezing, because both of them are kind of amavastha, right? So
Okay.
you go through the indications of Pratimarsha and the time period which is told. It is told in different time periods only just to tell that it is not so, what do you call it? It can be widely used, like the way how it is told for Matra Basti or Yapana Basti. But when it comes to specific conditions like this, it is not indicated.
Okay, sir. Thank you, sir. 9-year-old boy has Akalika Palitya. Please let me know the dose of Marsha Nasya to be used.
So the dose of Marsha Nasya, what you mean here is a very generalized kind of thought. What you need to think here is, being Akala Palitya, which kind of Nasya what you are going to use here. Than Marsha or Pratimarsha or any other kind of thing. What you need to think first about is why you are intending this Nasya for. Where you are considering this Akala Palitya.
Yes.
So it will be once again a Brahmana Nasya which you will be thinking about. Right. So when it is a Brahmana Nasya which you will be thinking about, you have already seen the kind of dosage patterns which we have written as per the matras, right? Remember, do you want me to go back to the slide for that? I'll show you with the slide itself. Yeah. So I'll get back to Akala Palitya where it was mentioned. Remember where it was mentioned in different types of Nasya? Here, look. So it is a Brahmana kind of Nasya, Snehana kind of Nasya, which you can think about. And in that, when you come about the dosage, even if you consider the Avara Matra, real avara matra in a normal person will come around 15 drops each nostril into 4 times, which will be too high. And practically we discussed it to be 15 drops at least 2 times in a day. But considering this as a small kid who is 9 years old, I will suggest on a practical base to at least go with around 8 drops.
Okay, sir.
Okay, that is a very vague, practical, based, experience-based matra which I have told, but at least 8 drops should be used, because 15 drops is the kind of calculation which we made on base of the Marshanas, which she has asked, right, specifically.
Thank you, sir. So the next question is, how to perform nasya in a person working in an air-conditioned environment, and also the Shirodhara nasya relation. Two questions asked together, sir.
How to perform nasya in an air-conditioned environment is very simple. Air condition is to condition the air from the outside environment, right? So always we condition the air accordingly so that we are not influenced by the extreme temperature of outside. Okay, so if any panchakarma therapy is done, right, from Abhyanga to what you call Vamana or Virechana or Nasya or Basti, we never make the patient stay in an environment which is too hot or too cold. Somewhere we keep the temperature in between 28 to 30 in an air conditioned atmosphere, which is very normal for the body. So in an air conditioned atmosphere, if you keep the temperature range in between 28 to 30, naturally you can do that. What is the second question?
Shirodhara nasya relation, sir.
Yeah, Shirodhara nasya. It's a good question. Actually, when you do certain procedures like Shiro Basti, which is one among the Murdini Taila, you know the level of pradhanyata of each. There is a very common practice that post to Shiro Basti, etc., there is a Shodhana Nasya which is being done, so that the Utklishta Kapha due to the Sneha is being thrown out. But when it comes to Shirodhara, based on the oil or the kind of intention that you have done it, you can decide whether you need to go for an Asya or not post to that. But during the process of that, strictly, I feel you should not do, because it will once again clog. If it is a kind of against Sneha Nasya, you should not go. If it is a Shodhana Nasya, you can. But what is the necessity? If you are doing Shirodhara, then that means based on the oil or the dravya that you are using, either you are doing some kind of Brahmana therapy itself. So again, don't go for a Sneha or a kind of Brahmana or what you call Utkleshana kind of Nasya.
Okay, sir. Thank you, sir. Nasya and infertility, please explain.
Actually, I have not done any work or anything as such on infertility with Nasya, because I'm not someone who's specializing on that. But as of what I have known from my seniors and colleagues and my students, what I understand is in females, actually Nasya has very systemic effect for managing the ovulation. So there are a lot of studies which are conducted on what was Krishna Tila Kwata, Krishna Tila Kwata, Tila Taila Nasya, Tila Taila Matra Uttra Basti, Mahanarayana Taila, etc. on managing the ovulation, ovulatory cycles, etc. You will get a lot of papers on that also. Same way, in males, I'm not very aware about it, but naturally, when you are thinking about Brahmana, you can think about Vrishya Dravyas, which including Mamsarasa can be used for any kind of Brahmana nasya which you can think about. But I am not personally aware about it nor used it. But still, I will explore about it.
Thank you, sir. So, in pulsatile tinnitus associated with atherosclerotic changes, which nasya will be beneficial along with the internal medicines?
In pulsatile tinnitus associated with atherosclerotic changes, which nasya will be beneficial. This is a clear-cut modern question. Okay, it is not very apt to answer it in such a way, but by respecting the this of the questioner, what I want to convey you first is, when there is a pulsatile tinnitus, we cannot directly correlate it to Karnanada and then finish it there. When there is an atherosclerosis, we cannot just directly correlate it to Srotoroda and end it there. We should actually think it along with the Lakshanas, which is presented by the person, expressed by the person, and diagnosed in Ayurveda perspective, so that which kind of Shodhana you need to initially administer. Considering the kind of question that you asked and the answer that you made, I feel if you think it as a Vatika condition with associated kafaja, it means Vata kafaja condition, then you can use any kind of oil which is Vata kafahara in nature, which can be used as nasya dravya.
Okay, sir.
And there are studies which shows about efficacy of Sarshapataila in management of tinnitus.
Okay, sir. Thank you, sir. So, management of pratishyaya or allergic rhinitis through nasya.
Katfala nasya, mapana, is one of the wonderful nasya which can be used for allergic rhinitis or pratishaya, one practical thing. Second thing is, even there are people who are using Lakshmi Vilasa Rasa, powdered form nasya. So they are also getting very good results. So by Yukti, based on pratishaya, wherein allergic rhinitis, which you can diagnose in a Ayurveda perspective and understand it on the base of its expression, whether it is in an Utklishta avastha, whether you need a Vairechnika nasya, a Shamana nasya, or a Shodhana nasya, you can choose the drugs accordingly.
Thank you, sir. Sinusitis complete cure, which nasya can be done, sir?
All the questions are very, what do you call, modern. You're expecting an answer like a foreigner, like a Google patient who comes to my OPD and tells, sir, I am diagnosed with cervical dystonia. Please give me an nasya. So it is not like that, right? We should actually understand it in a Ayurveda perspective and what is the Lakshana that is being expressed. For example, I'll tell you a clinical situation. Imagine a patient comes with headache. Okay, and this headache goes on increasing by afternoon. The patient is a diagnosed case of migraine. Okay, she or he gets a recurrent cold. Okay, when you look into the history of the patient in the OPD card, it is written by previous doctor, patient known case of sinusitis. Now, what will you diagnose this case as? Whether it is a sinusitis or whether it is a migraine. Or you should look into the patient at the present situation and see what is the present situation, whether she is in a condition of ama where she is oozing out things, or whether utklishta where she is oozing out things, where she is in a condition of ama where she is having all other associated ama lakshana, or whether she is in a nirama lakshana. Based on these three situations, I will have a difference of approach in my approach to the patient also. If it is an Amavasa, I will go for Amapachana without doing any Shodhana or thinking about any kind of expulsion at that point of time. Once Amapachana is done, then I will go for certain kind of internal or external kind of therapy, which will actually cause some kind of Utklishta. But imagine the same patient is in an Utklishta avastha. I can give certain kind of Nasya like Gudanagara Nasya, which can actually expel it out completely. So So it is based on the avastha of the disease. It is not just based on the name of the disease. The same name, the same disease can come with both amavastha or niramavastha or even an utklishtavastha. So based on that, you should think yourself and decide on the kind of approach that you will have.
Thank you, sir. So, in nasapana, should the patient swallow or spit out the medicine once it reaches the throat? Why nasapana concept was introduced, sir? Will it be more effective compared to nasya?
No, actually, it is as same as nasya. That's why I was trying to analyze it. When I went to the classics and looked into the concept of what I felt is it is not just based on dosage. It was like to give more importance to Kuata preparations. If you look into other contexts, there was various dravyas being told right from Grita, Taila, Kshira, Mamsrasa, etc. So Nasapana had this context of giving more kind of Kwata dravyas, which is a prepared form one among the Panchavidha Kasha. If you remember, I showed you a paper also based on that. So Nasapana is very similar to the Nasya Karma, so wherein we spit out the entire thing. There is no kind of keeping it or swallowing it. It is same kind of Nasya Karma itself, as of what I explored. And what I feel is Chakradatta is the one who has explained it. So being a later text, what he felt was to explore the utility of, Kwata in the nasya karma as such, as directly in an avichinna dana, because when it's the kwata, you don't need to drop it with a pichu or something. You can directly do that.
Thank you, sir. How to prepare Gudanagara nasya, sir?
It's a very simple process. You need to take around very minimal quantity of ardraga swarasa. Okay, and this should be mixed with guda. Okay, the small quantity can be 5 ml or 10 ml, minimum quantity. This should be mixed with guda. And now double part you should mix it along with cow's milk. I'm telling it on the memory what I have when I learned it in my undergraduate studies. Okay, I'm not very confirmed, but I'm telling this is what I remember. Guda in a very small quantity like 5 ml or 10 ml, but take double quantity cow's milk, mix it along with it, and this swarasa of Guda and diluted Guda and swarasa of Adraka along with cow's milk will make it a Guda Nagara Nasya.
Thank you, sir. Sir, in obstructive sleep apnea, how well can we utilize nasya karma, sir?
In obstructive, what I couldn't hear?
Sleep apnea.
In obstructive sleep apnea.
How well can we utilize the nasya karma?
Oh, no, sleep apnea is very, common right nowadays, and there is kind of clips, etc., what they use for actually preventing it, and people take it as a very serious affair. So, as of such, what I understand in sleep apnea conditions is you can actually manage that in two ways. One is in a preventive way, wherein you can actually try to avoid it by doing regular pratimarshanasya. One. Okay, there are papers also which will explain about the result of pratimarsha nasya for preventing it. When it comes to curative aspect, you should look into the condition. So I think vata kafahara kind of shodhana nasya will be really beneficial in this kind of sleep apnea conditions on a broader line. But as of what I said previously, in sinusitis case, based on the avastha, based on the condition, we should very wisely choose the medicine which should be used for sleep apnea.
Thank you, sir. Sir, please explain your experience of nasya to avoid surgery for DNS. Could you please explain? Yeah. Yes, that's the question, sir.
The experiences myself. I'll show you with the video here. You can look into my nose. Look, I'm a very severe deviated nasal septum guy. And when I was doing my undergraduation in Hassan, I had severe, what you call, sinus issues as such. And then one fine day, during my final year, I went out and saw this procedure called as antral wash. Have you seen that? Which is one of the treatment method for chronic sinusitis. Have you seen? Have anyone seen it? It is a very, very tough procedure wherein they pump in very high pressured water through sinus cavities and suck it through a sucking machine to take out the sputum. You've seen the sucking machine in operation theaters, right? The same sucking machine is used to suck the sputum from the mouth and nose by putting in a very forceful, small, what you call, pipe, like a service center servicing a car with high pressure water. This is pumped into the sinus and the sinus is cleaned up. After seeing that, I got scared. Then later on my surgery posting, I saw this DNS operation. What was the name of it? I forgot. The operation, it's a very simple, wherein this skin is cut and the nasal septum is removed and then skin is kept back. And but the fact is that the people who have undergone septoplasty, the people who have undergone the procedure also suffers again from the similar conditions that is being for a DNS person. So what my experience is, my teachers, especially I will like to remember my Shalakya teacher, Dr. Ashwini madam at Hassan. She had first made me undergo a Virechana, very tough. I was made to stay as an IPD patient to undergo the Virechana. That was the second Virechana in my undergraduation. And then she conducted a nasya with Gudanagara. And that's what actually got me rid out of this DNS. And now I'm living in Delhi. It's 7 years. Thank God. Till date, I have not, touch wood, I have not got any kind of problem, because once in a while, when it is a normal Ritu, which is very rarely happening, I at least try to use Anuttaila. At least in this COVID time also, we were forced to use it by All India Institute of Ayurveda. So Anuttaila, Pratimarsha, in a very lower dose, like 2 drops we were using. So I think Pratimarsha prevents it. And when it comes to Shodhana, when it is severely accumulating, you can use Gudanagara, etc. to remove.
Thank you, sir. So, what is the quantity of sugar and milk for nasya which you mentioned? Should we use raw or boiled milk?
No, never a raw milk would be used, as of what I understand, like how we use anything in Basti, which is lukewarm or which is made warm. In Nasya also nothing other than in Avapida, where Swarasa is being told, we will not use anything as such directly. And the quantity for Guda, what I didn't understand, Ikshu and Kshira.
Sugar and milk for nasya, sir. The quantity of sugar and milk for nasya which you mentioned.
It should be probably in equal quantity, which I'm not very particularly sure about it. I think it would be in equal quantity, which should be prepared as a nasya dravya, like mixing it in equal quantity because anyway, it cannot go beyond saturation and become some kind of viscous liquid. The viscosity of the kshira will be increased more when you put in a equal quantity of sugar. So if Madhura, actually you should understand the use of these things there. Why, what you call, Sharkara and Ikshu is being told. The reason is both of them are Madhura Rasa. And once again, both of them are Shitaviri. So based on that, based on the principle, you can increase the Madhura Rasa by increasing the Sharkara. The Shita can be increased if you actually refrigerate the Shira also. So it is all based on the Yukti of the Vaidya, so that you should use always something which is lukewarm. And if it is in a condition where warm things are not to be used, like where bleeding or something is happening, then you should use it in a normal temperature by adding equal quantity of sugar. That's what I feel. Still, I'll refer about it. We have to refer the thing.
Thank you, sir. Sir, is there any contraindication for giving Marsha nasya along with any of Murtini Taila?
I mentioned it previously also. Look, Murdini Taila has an intention which is Brahmana, Snehana, right? So when you are doing that, once again, why do you want to do a Marshanasya to cost double Brahmana? So it is not contraindicated. It can be indicated wherever it is necessary as per the condition. But usually, any kind of Shodhana Nasya is done after the Murdini Taila to remove the Utklishta dosha, the way how we do a what do you call kavala or a dhumapana after a vamana, just to remove the shesha dosha.
Thank you, sir. So we have two questions from the YouTube live chat. Shall I ask them that, sir?
Yes, you can.
Okay. So which nasya should be given in Timira?
I'm the wrong person to ask about it because I'm not a Shalakya expert. As I'm talking about it, I can tell you some reference based on the research works or something. Timira, as such, can be in multiple reasons. So based on that, you should do proper shodhana and do select the specific kind of dravya which will be useful in that. Now, till minute, it was like, I always feel very, what do you call, very light about such kind of questions being always asked. Like, for example, after a presentation on thyroid disorder, someone is asking, what is the best yoga for thyroid, sir? So these questions are something like that. Till a few minutes back, it was always on modern parameters. Right now, it just turned around into one. So imagine the kind of Timira Chikitsa which is being told. It's not just one, situation or one condition. If you think you have situations like uveitis, choroiditis, retinopathy, etc., which all can be considered under the basic concept of Timira. Right. So based on that, the presentation, you should undergo Shodhana. Then you believe it or not. Not just Nasya, we are even conducting Chakshushya Basti, Chakshushya Yapana Basti, which is giving very wonderful result in various kinds of Timira, the patients who are admitted here. So just don't restrict your thought process with one disease, one kind of treatment, one problem, one approach. It's not like that. Based on the avastha, based on the kind of lakshana which is being expressed, you have innumerable options than a modern doctor to deal with it. So to name a few, what you call, yogas which are commonly used, very commonly, Jivantyadi, Mahatrifala, Patoladi, these are some simple yogas which are very commonly used in such conditions.
Thank you, sir. So the next question is, Namaste, sir. Nasya in Pakshaghata in space occupying lesion and hemorrhagic cases.
I think the one who has asked this question would have heard the previous answer and already thought of withdrawing the question. It is not a generalized thing. It is not a generalized thing at all. But for your question, what I can answer is based on the condition. What you have asked is a very generalized question. Nasya and Pakshaghata, which are space occupying, and what lesions he has?
Space occupying lesions, sir.
So in initial phase of such CVAs or cerebrovascular accidents like hemorrhagic stroke, etc., it is always advocated not to indicate nasya karma in the initial phase. As I told you previously, you have hemorrhagic stroke, you have infarct, you have multiple lacunae. So many causes will, even tubercular lesions can cause a cerebrovascular accident and result in Lakshana like Pakshagata. So considering the background pathology, what really caused is very important when it comes to Pakshagata. So in an initial phase of what you asked, like space occupying lesions, you should avoid Nasya Karma and basic starting phase when they come. Later on, when the things are in a after Shodhana, Mrudu Shodhana, after Brahmana, when things are in a phase wherein there is Pitta Anubandha, Kshirabala Avartita would be one of the best choice for Nasya Karma. It is one of the very common Nasya Dravya which we have used. Also, it is very helpful as Talam also along with Rasnadi Churna. When it is kind of muscular related pathologies which is caused after such CVAs, you can even have what you call Dhanvantaram Avartita in such CVAs. Aphasia is one of the most common affected condition in such pathologies. One of the recent patients who got discharged 2 weeks back, who had a CVA associated with aphasia. You can imagine the Pakshagata is still there, but what he lost was his complete speech, and his age was around 38 years old. He was a Punjabi, and he was very angry with everyone, even without being able to speak by making sounds. What we did as a plan of treatment was, considering his hemorrhagic pathology, we initially did Pachana with kind of Dhanyamla Dara, Takra Dara, etc. Then we went for a Virechana. Then after Virechana, we gave him Kalyanaka Grita Nasya. And also we used Kalyanaka Avaleya Kshara intermittently, and you won't believe, he himself calls me right over the phone. And recently we had started a new Panchakarma setup in a hospital called Sabdarjan. So when I went to that hospital, one sister came inquiring for Dr. Prasanth on the second day. And I was shocked. How was my name known to someone in a new hospital where I am going for a new setup? And the sister came and called a video call to show him speaking over the phone, telling that the same patient was admitted there for 15-20 days and he couldn't have any kind of recovery, but now he is able to completely speak. I am the cousin of the patient, and the understanding that your hospital came, I inquired him who is the doctor who treated you, and I just wanted to meet you to thank you. That's why she came to meet. So it's a very wonderful area which we have a lot of scope, but the phase or the avastha is very important. The kind of treatment that we adopt is also very important. The yogas which we adopt for what is also important, like whether it is Brahmana, whether it is Shamana, whether it is Swara or Vak Prasadana. You should imagine about that and select the yoga for using in the specific kind of nasya.
Thank you, sir. Thank you so much for patiently answering all the questions, sir. So that is it for the questions, sir. So shall we conclude the question and answer session, sir?
Sure, sir. I will share the presentation with the organizers, so you can share it with the participants wherever. I think you have a WhatsApp or a Telegram group. Please go through it. Probably it will be very boring for you, but it will be a very inspiring beginning to assess and analyze yourself. And remember, there is a very wonderful presentation which is there on the net in Ayurveda network, of which was done by Prakash Mangleshwari sir. Please do observe it. Still, I cannot take away the pain which is there inside me, that I cannot call him and ask about the doubts which I have. So share the kind of experiences and knowledge what you have. So I'm still learning. I told, even I was practicing Pratimasha Nastya with 4 drops. So now after learning for your presentation, analyzing and understanding it, I understood that it is minimum required that at least 5 drops each in nostrils will only get to an avara matra for us when it is even Pratimasha Nasya. So we should really rethink and practice this Nasya Karma in a very classical way, at least to the nearest possible level, which we need to, even though we cannot be able to adopt this in very larger doses. So remember, even in very minor and minimal doses, it is helping us. So what if we go a bit more ahead and do that? So once again, I thank all the organizers and all the people who pushed me to do this. Thank you very much. Thank you for all the listeners for patiently listening. Still 29 participants are there. So I'm really thankful for listening. Thank you very much.
Thank you, sir. Now I invite Dr. A. Hita Ma'am, Assistant Professor, Department of Shalya Tantra, Ayurveda, Coimbatore College, to deliver the vote of thanks.
Good evening, everyone. It is my privilege and a great joy for me to extend a vote of thanks for today's session. I would like to express my sincere gratitude to Dr. Prasanth Dharmarajan, sir, for sharing your valuable knowledge on nasya. Thank you, sir, for an enlightening presentation and for taking your time to clear all the doubts of our delegates. Thank you. Lastly, let me extend my gratitude to all the delegates. Thank you all for being with us today. Thank you, one and all.
Thank you, ma'am. Dr. Deepti G. Godpal, MS in Ayurveda, Associate Professor, Department of Rachana Sharira, SDM Institute of Ayurveda and Hospital, Bangalore, Karnataka. The topic is about routine knee journey injuries. These are the details for next webinar. Work for a cause, not for applause. Live your life to express, not to impress. Thank you all for patiently listening and for the valuable time spent. See you all in the next session. To know more about our updates, please do stay connected with our social media platforms. That's all for today's most interesting session with a lot of new information for us to close our eyes with thought-provoking knowledge. Thank you all for joining us. Thank you.